Interesting breast augmentation case. Our patient has lost weight, 40 to 50 pounds, and that's caused some looseness of her tissues, but she's also got interesting findings with her breast in that it's tight underneath or constricted for the inframemory crease below the breast. Since we want that full rounded shape, we're going to release to lower the crease to get the breast centered, the nipple centered over the implant and get a pretty shape. Here we are on the table with the right breast. I made my pocket through that incision down below, and I've worked to release this lower breast tissue so that it rounds out. We want that pretty rounded shape underneath the muscle with the implant pocket. Patient is under IV sedation, so our anesthesiologist is monitoring her, but she's breathing on her own, not under general. We love doing these under sedation rather than general anesthesia. General anesthesia works great, and it's certainly a good option. Many surgeons use that for this case, but it does have a hangover. So for a few days after general anesthesia, you're definitely more tired and don't have as much energy. That's one benefit. The other is by getting me to put a good block in place to block the nerves. The breast is mostly asleep. That long-acting medicine lasts well after surgery, so it helps significantly for recovery because you don't have nearly as much tendency to have pain in recovery when we block the breast. We are using a round silicone gel implant with a textured shell going underneath the muscle. And right now I'm looking and carefully releasing this lower pole where there's that constriction or tightness. Army, Navy. Irrigate. This brown betadine solution's antiseptic, strong, broad spectrum antimicrobial activity. So you'll see brown a lot in the areas I'm doing using breast implants. We're always working to minimize potential for complications with an implant. We definitely consider that pocket to be contaminated. So re-prepping, I just re-prep, seal off the nipples, seal off the chest, new gloves, wash the gloves, and I use a funnel to insert the implant so that we're not letting the implant touch the skin. All those are to decrease the chance of contamination. Funnel allows me to use a small incision as well as not allow the implant to touch the skin. Here's our textured round silicone gel high profile implant. For her, that profile is 12 centimeters wide to fit her breast. For someone else, it would be a different dimension, so larger for a wider breast, narrower for a narrower breast. So the implant did slightly touch the skin here. And everything we're doing is just to minimize those opportunities for contamination. Everything looks good. I am going to go ahead and irrigate a little bit more betadine and suction. Seems to be the implant manufacturers are worried about betadine, and it turns out that's if you fill an implant, like a saline implant with betadine, and it is not a problem for betadine in the pocket. It does not degrade the implant. Take a stitch. Underneath, that is her 3D capture. This is the simulation of the implant size we chose. I love this 3D simulation. It's much better than the cup size guessing game, and overall it's going to do a very accurate job of showing us the actual breast size you would get. We definitely want a pretty shape. We don't want that round implant up here with the nipple hanging out off the bottom. We want it centered behind the breast, so we're going to get more round underneath. I've done that by releasing the lower breast, slightly lowering the breast crease. Over here, basically where it's tight and constricted underneath, that's increasing this distance, working to get that full undercup shape and full perky rounded shape above. Then from the front, we want the crease to be down here where we get that more rounded shape where it's a little tight in the middle and it's tight all the way across. We'll take a look in the table and compare the difference.